So I'm going to change tack a little bit, and I'm going to be focusing a little bit about Palestinian and Gazan healthcare pre 7th of October, since the ongoing genocide. Um, so these will be some of the things that I'll talk about today. So as Murshid said, I've been going to Gaza since 2014, 2015, and the West Bank since 2011. I think it's important to highlight what was happening in terms of the healthcare system prior to the 7th of October, which gives some context to the current situation. This quote is very important. I think it's from WHO basically stating that the conditions in which people live and work can help to create or destroy the health, and it's extremely relevant to what's happening in Gaza right now. I don't need to lecture anyone here about the geography of Gaza, but we can see the population density over the last 20 years in an area that has been under continuous siege since 2006, 2007. And the healthcare system in Gaza was essentially a disjointed service from the days of Christian missionaries post Nakba. And between 67 and 1993, the Israelis were essentially in charge of it. Following on from that, the Palestinian Ministry of Health took over and increased bed capacity at that stage. But because of neglect, poor management, corruption, the hospital system, healthcare system had been struggling for many years and was very much dependent on referrals abroad to neighboring countries. Now, these uh, news stories of an imminent healthcare system collapse in Gaza are not from 2023. They're in fact from 2017, 2018. This has been a system that has been under enormous pressure for a very prolonged period of time. And what were the threats to health in Gaza pre 7th of October? Well, direct threats to health included IDF airstrikes and attacks from Operation Cast Lead and moving on, problems with sewage and water sanitation, destruction of housing, and then indirect threats to health from sonic booms and the psychological effects on children to malnutrition, which we are seeing now on a mass scale, and even the power cuts that have effects on healthcare. And these power cuts, have been an ongoing issue in Gaza. As you can see, between 2006 to 2016, it was usual to have at most 8 to 12 hours of electricity a day. And that went down to 2 to 4 hours a day in 2017 when the situation was very difficult at that point. This is well before the current genocide. And these effects are devastating in terms of critical service provision, in terms of neonatal adult intensive care, in terms of hemodialysis and refrigerated stocks and vaccine stocks. And again, another report from 2017, 2018 was saying from MAP, said very clearly that the health crisis in Gaza at that time was largely due to the closure of borders by the Israelis and the ongoing siege, delays in permits for referrals, difficulties in medical professionals being able to train abroad, and difficulties for international experts like our team that were going in to be able to visit, in addition to outdated medical equipment. And we can see from this headline from MAP that even 2017, patients were dying, waiting for exit permits to be able to go and have tertiary or quaternary care in neighboring countries. This was an issue even back then. And in terms of malnutrition, we've seen health effects on children, with poverty leading to poor health and that vicious cycle resulting in acute on chronic malnutrition, with growth stunting and rickets increasing 50% over 10 years between 2007 and 2017. And then the long-term negative sequelae of that in terms of immunity, physical, and neurodevelopmental consequences. And this was the rates of stunting you can see in the West Bank and Gaza between 96 to 2006, increasing gradually. And now we are obviously in a completely new paradigm with a famine that is imminent, if not happening as we speak. And in terms of mental health, young people, adolescents in Gaza suffer from substance misuse, domestic violence, PTSD, all the effects of an ongoing siege since 2006, 2007. And children, younger children, were well shown to be having episodes of bedwetting as a result of sonic booms, anxiety, depression, And the rates of mental health disorders in people in Gaza were through the roof up until the recent atrocities. And we saw as the news rolled through more and more devastating stories about children. The children in the incubators taken out because of the lack of electricity at Al Shifa and bundled together, premature babies that should be getting incubators and should be getting oxygen and feeding bundled together in this way. We saw the decomposing bodies of children in the intensive care unit of Nasser Medical Complex after the withdrawal of the doctors and the return of the medics to find these bodies that were forced to be abandoned by the Israeli occupation forces. We see effects on women and maternity care, 50,000 women pregnant in Gaza, 5,000 deliveries a month, no antenatal services in the north or center of Gaza, and continuing difficulties for these women that are in great need of basic maternal services. And as a result of the complete destruction and breakdown of healthcare, we are seeing diseases spread at an excessive rate. We are seeing, again, this is back in December, January, when we were already thinking of the fear of and risk of cholera spreading throughout this community. And the WHO themselves said that disease could be a bigger killer than bombs in Gaza. And we saw the excess mortality rates coming out. Published work by Zaina Jamal al-Din from the London School of Tropical Medicine. These projections from February to August of this year showing even in a ceasefire scenario, a huge number of deaths, but in a status quo or an escalation scenario, the deaths just exponentially increasing across all disease groups. And we once again saw the Integrated Food Security Program coming up with a classification showing only a month ago that the majority of the north and central of Gaza was in imminent risk of famine. And it is very highly likely that we are in this stage now, approaching May 2024. I think the one other thing that has been incredibly unique in a horrific way about this genocide is the targeting of healthcare facilities. We have seen damage to pretty much every hospital across Gaza. These are news stories, as you can see. Indonesian hospital, Al Nasser Children's Hospital attacked, the PMRC Center, the Rehabilitation Center, Al Shifa Hospital. Every one of these hospitals has been either decimated or shut down or bombed or attacked by the Israeli occupation forces, which led to the MSF for the first time in their history stepping up and taking sides and effectively and saying how there needs to be a ceasefire, there is indiscriminate targeting of healthcare facilities, and there needs to be a stop to collective punishment of Palestinians. We also saw, as a result of these attacks, hundreds of healthcare workers are being killed and abducted. And I want to share some stories of some of these people who we remember them and we mourn them. This is Dr. Omar Farwana, who is the Dean of the Faculty of Medicine, the Islamic University, a larger-than-life character, an incredible man who had studied in the UK and had provided 30 years of service to the people in Gaza. He was killed by the Israelis alongside his wife and 13 family members, including his daughters and granddaughters on the 15th of October. Dr. Hamam Alou, 36-year-old nephrologist at Al Shifa, who refused to leave his patients and evacuate to the south when Shifa was under siege, and he was killed by the Israelis when his house was bombed next to the hospital. Dr. Roa Hamam Hanea, first-year med student at the Islamic University, and it was her dream to graduate as a doctor and help the people of Gaza, also killed on the 10th of November alongside multiple family members. And Nada Dashen, a pharmacist who graduated 4 months before the 7th of October, and she had planned on traveling on a scholarship, was killed by the Israelis on the 21st of November before she could live any of these dreams. And these are just amongst, the hundreds, at least 485 odd now health workers that we know that have been killed by Israeli attacks on Gaza since the 7th of October. So before I wrap up, I just wanted to talk about some of the work that we have been doing in solidarity with folk back in Gaza and the West Bank. So we started an initiative called Gaza Medic Voices. I think many of you have seen the testimonies. This is led by an amazing duo of Dr. Tani Haj Hassan and Dr. Rebecca Inglis, who are medics who have been traveling with us to the West Bank and Gaza over the last 10 years. And this was effectively testimony from the health workers on the ground in Gaza, providing first-hand eyewitness accounts of what they were seeing. And feel free to look on Instagram and read these, but these are horrifying, horrific quotes of some of the day-to-day experiences they have had throughout the last 7 months. And moving on from that, we decided on the 10th of November as health workers in the UK to hold vigils outside 10 Downing Street. And this was resulted in us starting as an organization called Health Workers for Palestine. This has been continuing essentially across the UK and across the world, in Sydney, in London, in Cape Town, and across many UK cities where we have been standing in solidarity with these health workers, reminding the world that they will not be forgotten, that they are in our hearts, and we are thinking about them constantly. And as you can see, many cities across the world, across 5 continents, got involved, and this continues to this day with weekly vigils across many of these cities that are listed here. Our work has gone from a grassroots community group of volunteers to now registering as an entity in the UK with a plan to do serious lobbying and advocacy uh, within academia, within parliament, within the BDS movement, and also impact projects on the ground in Egypt, which are being led by our CEO, Amira Nimrawi. And this will work, especially in Egypt at the moment, on helping some of the Palestinian women and their children who have come out of Gaza and need rehabilitation in terms of their lives, in terms of shelter, food, accommodation, the basics, things that unfortunately, even in Egypt, they are not able to get freely and easily. And this is the team. Amira Namrawi, the CEO, is Palestinian who's works with Palestine Medical Relief Society as well, and has been key and instrumental in helping us set up on the ground in Egypt and also across many of the continents. And we have Dr. Mohammed Amara, Rehab Adil, and Dr. Miriam Francois are the key members within the executive team. And finally, where do we go next after this? We've been talking about the day after for an extremely long time now. And sometimes in moments of helplessness, I wonder whether there will be a day after. But we have been waiting for a ceasefire for 7 months, and the priority has been aid, it has been food, it has been fuel to go into Gaza to support the rebuilding process. And we are seeing more and more medical and surgical teams go in by MSF, MAP, Fajr Scientific, and others. And I think the reality is, and this is what we are seeing from the medical education sector, is to rebuild, rebuild, and rebuild. And I just want to end on a note of acknowledgement to some of the heroes of mine that have taught me much of what I know about Gaza and Palestine. And these are people like Professor Colin Green, the head of IMET 2000, Mr. Nick Dudley, who was a surgeon that set up the Oxford Teaching Initiative that has been going into Gaza and the West Bank since 2000. Sir Terence English, a famous retired cardiothoracic surgeon, and Sir Ian Chalmers, the founder of the Cochrane Collaboration. And then the other heroes who, many of whom you will recognize from your TV screens, including Khaled, who have just come out of Gaza on multiple missions, James, Tanya, Nick, and Debbie, and many, many others that have been doing incredible work to support their colleagues.